Question number 5. Identify the abnormality. What do you think, guys? What do you think? Okay, let us try to understand this. I can see the talus. This is a white color. I can see the talus. I can see the calcaneum. I can see the cuboid. I can see the medial cuneiform, the middle cuneiform, and the lateral cuneiform. And I think something has happened to the size of the navicular. It should have been a bigger size bone, but the size has been drastically compromised. And I can see that in the other view as well. Blood supply of the navicular is gone. See, basically you have to understand this is called as Kohler's disease. I'll tell you what this is about. See, Kohler's disease is something which basically involves this bone called as navicular. Freiberg disease is basically something that involves the metatarsal head, particularly the second metatarsal head. Panner disease is basically something which involves the capitulum. Kienbock disease is basically something which involves the lunate. Now, what do you mean by involves this and involves that? See, you have to understand that there is a term called as osteochondritis. Osteo means bone, chondri means cartilage, adis means inflammation. Alright, so osteo means bone, chondri means cartilage, adis means inflammation. So this is inflammation of the bone and cartilage complex. Now, a very, very interesting thing that I want to share here is that osteochondritis is of two types. One is what is called as pressure or compression or crushing type of osteochondritis. So one is the pressure or compression or crushing type of osteochondritis. The other one that we have is basically traction type of osteochondritis. So if you put a lot of pressure on a bone, that will certainly damage the blood supply of the bone, leading to pressure type or compression type of osteochondritis. Out of which first example is Panner's disease that you should know. Panner's disease is something which basically involves this bone called as capitulum. Then you have Kohler's disease. Then you have Kohler's disease, which basically involves the navicular. Then we have the Kienbock's disease. Kienbock's disease is something which basically involves the lunate. And the fourth one is the Freiberg's disease. Freiberg's disease, which basically involves the metatarsal head, particularly the second metatarsal head. As far as traction osteochondritis is concerned, the first name is Osgood-Schlatter disease. The first name is Osgood-Schlatter's disease. Now, this Osgood-Schlatter's disease basically involves tibial tuberosity. Okay, the second one is Sever's disease. Now, this Sever's disease basically involves the calcaneal tuberosity. So what I will do is, I will just now show you something probably that can give you an idea of what am I actually talking about. I'll just show it to you. That will give you a fair idea of what are we dealing with. ठीक है, सामने देखिएगा सब लोग. Everyone, please look at the screen. So if you see this, then second metatarsal head, it is crushed. The blood supply is crushed, if you can see. Can you all see that? Can you all see that? बताइए सब लोग. So this second metatarsal head blood supply is gone. So this is called as Freiberg. Now see this Kohler's. Now can you see this Kohler's here? The navicular blood supply is gone. It is clearly visible. Now can you see this Kienbock? देखा आपने? So this is basically the lunate blood supply is gone. So that is what is called as Kingbach disease. So whatever examples that you've seen just now, they are the classical example of pressure osteochondritis, compression osteochondritis. Let me just show you the classical example of distraction osteochondritis. Okay, let us show you the example of distraction osteochondritis. So this is Osgood-Schlatter disease. Now can you see the Osgood-Schlatter disease? You can very well see Osgood-Schlatter disease. So you can see the formation of a bony spicule. Okay, so you can see the formation of a bony spicule around the insertion of the ligamentum patelli onto the tibia tuberosity. I'm sure you all can see that. Okay, so there's a bony spicule around the insertion of the ligamentum patelli onto the tibia tuberosity. That is what is called as Osgood-Schlatter disease, because this person quadriceps tendon is pulling up, and it is pulling up the patella as well. Okay, it is pulling up and it is pulling up patella as well. Okay, so it is pulling up the ligamentum patelli, it is pulling up the ligamentum patelli, it is pulling up the tibial tuberosity also. Can you see that? So it is because of a lot of excess pull. Now if you see this, then it is Sever's disease. So there's a significant pull. There's a significant pull. Okay. So there's a significant pull. Can you see that? Of the tendon-achilles onto the calcaneal tuberosity. So it is giving rise to Sever's disease. Alright, so it is giving rise to Sever's disease. Can you see that?